So the way anxiety and depression presents in adults is quite different from the way it presents in children and adolescents. When the child says, sometimes the mental pain is so overwhelming, the physical pain takes it away. There is a lot of, unfortunately, bullying going on in all schools. Maybe we first focus on helping the child feel better about themselves, and then we can trace it back to where it probably started. So it is more about trying to see what the child is not able to do at the moment without help. I love this generation. I'm talking about the youth of this current world. I love them because they are so open, right? They are so self-aware.
Welcome to the Mind Reimagined, a podcast offering paths to mental wellness. I'm Ellen Chamberlain. Today, we're going to talk with Dr. Gayathri. She is a senior consultant and child psychiatrist at Maarga Mind Care with more than 7 years of experience. She holds an MBBS, MD of Psychiatry, and DNB Psychiatry. Her specialized focus on child and adolescent psychiatry was further shaped by her time at the Institute of Child Health in the Government Hospital for Children in Chennai. Dr. Gayathri's area of expertise does also include ADHD, autism spectrum disorders, learning disabilities, eating disorders, as well as anxiety and depressive disorders in children and adolescents. She's committed to a compassionate approach that helps parents and teachers understand complex behaviors in children and adolescents. Hello, good day. We are going to have an episode today called What We're Missing in Our Kids, what we call it versus what it is. Welcome, Dr. Gayathri. So often, parents and teachers label a child as lazy, uncooperative, or unfocused. To begin, can you help us understand the difference between what we may perceive as a character flaw and a potential underlying issue?
Sure. Thank you so much for having me here today. So nice to speak to you.
Great to see you.
So coming back to the question you asked me. So it is very common that when a child is being termed as lazy or uncooperative, there is usually something else which is at play underneath. Most of the children do not want to be failing at their parents or failing at school, or they do not want to be termed that way, right? It is usually a sign of something which is underlying, a difficulty, if you will. If we take the example of when a child is called lazy, it is usually in the context of avoiding schoolwork or avoiding homework or avoiding certain chores at home, perhaps. Most of the times, it is probably because the child is having some kind of difficulty in doing the work, and therefore they tend to avoid it, right? Or when a child is termed as uncooperative, when they are not, listening to what is being told at home, right? Which is usually looked at as disobedience, right? It is possible that the child is having fatigue or is feeling overwhelmed with something, which is never really taken into the context at all. Right?
And sometimes it can be auditory processing.
Yes.
Difficulty following directions.
Yes.
Yeah.
It could be sensory sensitivities too. Mm-hmm. So many times there is usually something underneath. When we call it as a character flaw, it is almost as if the child is intending to behave in a certain way. So whenever I speak to parents or teachers or any adults about this, I tell them to take a different lens. A lens of curiosity rather than the lens of blame. Trying to see what could be the underlying problem that is, making the child to exhibit the behaviors that the parents or adults are seeing. To give an analogy, perhaps, when children, they are not able to read the board because their vision is blurry, we would not term them as lazy. We would probably give them glasses to read, right? So it is more about trying to see what the child is not able to do at the moment without help, giving the help to the child, and therefore enabling the child to be the best version of themselves.
What we might call accommodations in some situations.
Yes, yes.
Let's discuss attention and hyperactivity.
Yes.
What are some of the signs of ADHD, for example, or an underlying learning disability that are commonly mislabeled as just being bad or not trying?
Right. The symptoms of ADHD are quite different based on the gender and age of the child. To give a small example, usually in the younger ages, say less than 10 years, what is commonly noted and therefore brought to the doctor's attention is when the child is being hyperactive, or rather does not have the sitting tolerance needed for that specific situation. That is more commonly reported in younger boys, when the parents come and tell us that they're almost on the go always, as if they're run by a motor, just running everywhere. And therefore, they are not able to follow instructions given. There is impulsive behavior that is not able to wait and listen to the questions asked, and therefore answer appropriately, for example, or so on and so forth with regard to the hyperactivity perspective of younger boys. Whereas as they grow older, right, it is the inattention component that sort of presents more, and the hyperactivity symptoms, they come down with age, right? So what will probably be noted would be the academic struggles, and that's what they will come for, right? But it is when we start, looking underneath the basic symptom that is being presented to us, we see that there is a challenge in sustaining focus or attention at tasks which require a longer time of, mental challenging or some kind of, focus. Right. And they might be often seen to be daydreaming, as if they are lost in their thoughts. Many times, the child will have difficulty with deadlines, therefore will not be able to start work on time, right? So it will always be as incomplete work or last minute preparation, right? It can also be seen as, changing interests very frequently. It's as if they cannot sustain interest in a particular topic or task for a longer time. They get bored very easily. Mm-hmm. It's almost like, they are functioning at 2x speed, right? And the world around them is not able to keep up, right? So this will result in some kind of academic challenges, which is what the teachers and parents note and come to us first. It is seen that in the female gender,
that's what I was going to ask.
Yeah, the inattention component plays a major role, right? That is, it is more significantly seen as a presenting symptom. So, since it is not so overtly seen from childhood, many times they fly under the radar, right? So, in fact, it will present as more emotional and behavioral issues as the child or female adolescent is growing up. It is because they are not able to persevere at something, right? So there is some kind of insight. The child knows that for some reason I'm not able to keep up at a task. And a secondary level of, low self-esteem or feelings of anxiety, feelings of inadequacy creeps in, right? And so this is what the child will present with when they come to us as emotional and behavioral issues. But many times it is the inattention symptoms which have been missed over the years is what is probably causing these kind of symptoms at present.
We're going to have another conversation at some point all about just this topic. Could you speak about some of the other behaviors from social withdrawal to outbursts that might be missed as signs of anxiety or depression or perhaps a different treatable condition?
Right. So the way anxiety and depression presents in adults is quite different from the way it presents in children and adolescents. In adults, it is quite overt at times, right? When at least adults have the verbal capacity to express their emotions, and they'll be able to process it and therefore express the way they are feeling in many situations. Whereas in children and adolescents, it presents mostly as, say, withdrawn behavior, right? They don't seem to be enjoying going out with their friends or doing things that they used to do. It could be a hobby, it could be their passion or interest. They might present with a lot of somatic symptoms, what we say as body aches, body pains, right? It could be any kind of body related concerns that they come up with. There could be school refusal, right? And invariably it presents as irritability and anger, right? That is how the children process the emotions that they're going through, and therefore it is manifested as how the parents and teachers and adults bring to us as adamancy or tantrums or anger outbursts or irritability, right? Invariably, there is something which is going on beneath the surface, which, if addressed in time, the child will be back to their lovely self.
Back on track.
Yes.
Let's talk about the professional's role. This can be a tough topic to approach. What is your advice for a parent or a teacher who is beginning to suspect there might be more going on with their child?
Okay. I think the first would be to have a conversation with their child. The cornerstone in treatment of any kind of issues with children, that is what we advise to all families and parents. One should be able to have any kind of conversation at home. That atmosphere needs to be created.
Ideally, yeah.
By the adults at home, right? That could be parents, grandparents, the extended family, where the child feels that it is a safe space and the child can come back and tell anything under the sun and there would be no judgment. So that would be the first preventive aspect of this, right? If that atmosphere is created, then the parents can very well go and have a conversation with their child. Of course, the child who is going through these things might have difficulty in opening up from the word go. That is understandable. But setting up this kind of atmosphere at home will eventually help the child to open up about what they're going through. That being the first, right? And teachers have a wonderful opportunity as being the gatekeepers, the first responders, right?
Right.
Many times, it's lovely how I've seen a lot of schools and a lot of supportive teachers are able to pick up on a lot of things which seem to be missed by other people. Of course, the children spend a lot of their days at school, right? So the teachers have the responsibility of being able to inform the parents about something they're noticing, right? And then it would be prudent for them to approach professionals who would then help them in the process of trying to figure out what is going on and therefore helping the child, again, to get back on track.
Let me ask you this. We are talking about kids from maybe 6 to 16. Can you give just a few examples of how we might broach the subject and ask how they're feeling, let's say, under age 10?
Okay.
Under age 13.
Right. The age plays an important factor here because we need to have age-appropriate questions for...
Right. That's what I'm getting at,
right.
Yes.
So, this is in the context of them approaching us in the hospital, or are you asking in the context of home?
At home.
At home. Okay. So, let's say the child is less than 10, right? Let the conversation first begin as just a check-in, right? How are things? How are things going at school? How are things with teachers, and how are your peers doing? Conversation needs to start off with being general rather than it just becoming like
What's
an
wrong
interview,
with
right?
you?
Exactly, right? That obviously puts the other person at a defense, right? So maybe it can begin with these kind of general conversations, and it can be general topics that the kid enjoys. It could be asking what's the next movie, when the movie is going to come out, or something that's happening around. Then the parent can probably, tell what they observe, right? So I've been noticing that you have been, not going out as often as you used to before. I'm giving the context if the child is avoiding peers and in that context, right? So it might just be telling what they're observing to the child, right? And then they can probably say, I'm worried that, you might be going through something and I sort of want to help you through it. That's where I'm coming from. And basically asking the child how they can be of help. Now, this would be, again, probably a little more elaborate if the child is an adolescent, because the child also will understand that the parents are maintaining boundaries and but they're still concerned about me, and therefore they want to ask me. And usually adolescents appreciate that a lot, right? When they understand that their boundaries are being respected, but the intention is that the parents want to seek help and therefore they're asking this.
Right.
It really opens up, right? I understand when parents and adults around the child, when they're extremely concerned, they are anxious, as anyone would be, right? Their most loved one is going through something and they're not able to help. It's a feeling of helplessness. But it comes off or comes out as, at times, as excessive anxiety, and therefore needing to check in, and therefore,
An interrogation.
Yes, that is how the child may perceive,
Right.
And therefore it is kind of counterproductive, because we ultimately are not any more aware of what the child is going on. And taking this stance of, tentatively respecting the boundaries, but still, telling the child, I feel a little worried about these things, and offering the child a space like, you can always come back and talk to me about anything. You need not fear that there's going to be any retribution or there's going to be any judgment. I'm just worried about you, right? Invariably, this conversation will help, right? Especially 13 to 16 and 17 onwards. That is when parents are extremely concerned. The child is more withdrawn or keeping themselves, always in their room. Maybe it is also a way to respect boundaries and still express concern. For a child less than 10, the first few questions would probably suffice, because the child generally becomes very much comfortable when you start playing. So, play therapy, right? That is why spending time with the children is of utmost importance in a family, right? Game nights, weekly movie routines, whatever it may be. A predictable routine that the child knows that they are going to enjoy with at home. And that period of enjoyment should not be a time where there can be critique or there can be questions about what's going on at school and other things. It's just a time to be goofy. And goofy time is always the best time, if you ask me. It is the most intimate ritual that can be. So for younger children less than 10, this kind of opening up with playing with them together, and then checking in, using terms that is appropriate for them. Like, are you okay? Is everything fine? I'm just noticing these things. You can always come back and talk to mama and papa. Do tell us. That sort of thing. It's more of a curious stance, expressing your concern and reassuring that whatever it may be, it can be taken.
The door is open. Yeah. I've really found that with either age group, if you create that space, that's all you're going to get out of that initial conversation, is just you have to be very casual. And well, if you want to, and then they will come back and make their way back into the conversation they need to have. So yeah, that reassurance, I love that word. That's a good application. What are some of the less obvious signs of disordered eating or self-harm that might be mistaken for just a phase or moodiness?
Okay. I think this is a very important topic to speak about, especially with regard to disordered eating, right? There is a lot of, unfortunately, bullying going on in all schools of the current age. This is going to be, I'm sure, applicable in pretty much every school of the country, more or less, right? Some of it comes out, some of it doesn't, right? Since I have the privilege and of listening to children trusting me with their life experiences, I understand that can be extremely traumatic for a child, especially of that age. I'm not saying that is the only reason that sort of leads into a child exploring these patterns of eating in different ways, but that is one of the most significant starting points. Sense that the child feels criticized for being the way they are. That can be at school, that can be at home as well, right? So, what it can look like many times at home is maybe eating a sudden change first, right? A sudden change in their patterns of eating, skipping meals too often, maybe splitting their meals into very, very small parts without really eating much, and eating very slowly, jumping to different diets every other day without really understanding or wanting to understand the nutritional aspect or science behind it. Using the restroom immediately after eating, right? Also, this extends into concern about what they're wearing, always needing to wear fully covered clothes, baggy, loose clothes, a constant negative sort of conversation about themselves when they speak about themselves, right? As if, they feel very low about themselves. And of course, anger and frustration, irritability, when parents note something and they're telling the child to eat as they would usually expect to be. And checking the mirrors often and picking at their skin, or sometimes it can be the opposite, completely avoiding any reflective surfaces, right? So all of these can point to something which is underneath, such as maybe an eating disorder or some kind of body dysmorphia, that is, they're not comfortable with under their own skin, right? So these are usually what the parents might see at home. And if they notice that this is a long enduring pattern of eating, then I think it is important to first have the conversation which we just discussed with the child, and then definitely seeking professional help. Maybe we first focus on helping the child feel better about themselves, and then we can trace it back to where it probably started. Many times when I see parents and concerned adults, right, when they come to me with this, they always want to know what is the cause. I respect that. I appreciate that. I mean, I understand where you're coming from, right? You want to, just ensure that never happens again.
Right.
But that would be like second line of importance for me, because I want the child to get better first, feel comfortable, and then we can try to address the root cause.
Right.
And we are all on the same page in ensuring that that never happens again. The child is never put in a situation where they have to go through these sort of things again.
And also giving them some coping tools.
Yes.
Yeah.
Yeah, that the professional can definitely help with.
Because some situations can't be avoided ever again. One thing that I have learned is that disordered eating, self-harm, doesn't always come from self-esteem, but sometimes, am I correct in this, in a lack of control, like perhaps if there's alcoholism in the family or some sort of drama and trauma, feeling very powerless, a person or a young person will sort of do a transference to something they can control, which is their food, and may not even be related to their body image.
You're absolutely right. Yes, that is the other side of the coin that is nobody really speaks about, right? It is a sense to gain control over the life situation. When a child feels helpless, when a child has been facing a traumatic situation, which they cannot really do much about from a very young age. Now, that can be in many contexts, right? Trauma can be big T or small t, but
Right.
the impact of the trauma is always going to be big T for the child,
Right.
right? Big T and small t is just what the viewer observer can objectively say. But
Right.
as a perspective of the child, maybe going through a difficult time with regard to the family atmosphere, maybe there could be interpersonal relationship issues within the family members, within the parents. There could be emotional, physical abuse. There could be bullying at school, one thing we did discuss. So all of these things, when it's happening over a chronic period of time, and the child is not able to handle the situation, because at times the child feels it is beyond their capacity to do anything about, because nothing seems to solve the issue, then they do at times use tools such as, eating or harming themselves as a way to gain control over the situation. When we're talking about
Over their emotions.
Yeah. When we talk about self-harm, many children, they say, when we ask them, right, what does this do to you? What does it do for you? Why do you harm? Why do you use this method of coping? There have been quite the variety of answers, but a couple have stuck with me over time. When the child says, sometimes the mental pain is so overwhelming, the physical pain takes it away for a bit, right? And then, of course, they understand it is a very temporary fix, and many times it doesn't really help. In fact, those children come back and told me, that is what I heard from other people, but it
Right.
doesn't really do the job of really healing my mental pain at all, right? That's when the professionals step in and we teach them other different ways which are productive and functional in coping with this difficult situation. There are children who've come back and told me that at times they just feel so numb, they want to feel something, and therefore they employ this method. Again, this is a way they are choosing to cope. There are many ways to cope, n number of ways to cope with a difficult situation. But that is when the adults, the professionals, the teachers, and everyone who is concerned would have to step in and teach the child what are the functional and productive coping strategies and what are the others which will lead to more harm in due course of time, right? Which the child is not aware at this moment. But that is where we come in and we educate the child. And, we give them more tools to work with.
Right.
We basically enable them to, so we validate what they're going through. No one needs to invalidate that what you're going through does not need this much of a reaction.
What are a couple of phrases that we use commonly that are invalidating?
Couple that I have heard over time, uttered in context of home, maybe parents, maybe grandparents. Again, it is mostly coming from a place of concern and anxiety. It is because maybe the adult is not able to understand the gravity of the situation and not able to cope with it themselves. It is maybe that is what is making them speak the way they do. But yes, some of it can be, why are you overreacting? That is nothing. These are simple things.
Right.
Or you can will your way through it. That's what we all used to do when we were younger.
Right.
Things have been, yeah. And nowadays, everyone seems to just talk about mental health and use it as an excuse. And they completely invalidate the child's feelings and emotions and whatever they're going through. Like I told you, it could be small T, big T, not even a T for the person who's looking, but for the child, the impact is still a big T, right? It's always a perspective of the child. So it is probably coming from a different place, not wanting to hurt the child. I'm sure no parent or no adult wants to hurt the child with intent.
Right.
It's coming from a place of not knowing what is actually going on. Maybe that's what I'm hoping that this conversation will help.
Yes, parents really need more support. I think the ableist language we use so often, we don't even hear when we say it. So that will be a great topic for our next conversation that we have planned. Today, it's a huge part of kids' lives. How can a parent or a teacher differentiate between a child's normal interest in video games, the newest thing, social media, and a behavior that might be a sign of something more serious, like an addiction or a dependence, social anxiety, lack of attention span? People are saying that ADHD is caused by social media, these sorts of crazy things. And I see how a layperson might make that connection. But that's really taking us so far off track from the things that you're trying to support.
So when parents come and tell us that the child seems to be addicted, I'm using that word because that's what mostly is told to us, to internet or video games. Increased screen time, according to me, is like a symptom. It is like a fever, right? A fever is going to happen if you have a GI system infection, if you're going to have a cold or a cough. It's going to happen it is a symptom, right? You have to go in and see what is probably causing this fever. And then you give the appropriate treatment as it is. In that way, increased screen time, we look at it as a symptom of something underneath. It is, many times, it is because of maybe an underlying low attention span, right? We do know that, at least nowadays, the video games and social media is being created in a way to ensure that these children and any adult or anyone's attention for that matter to be hooked. It was not the case, say 20, 30 years ago, when we look at the TV programs or anything else that was on screens at the time. So when you look at it, using video games and internet is not by itself a harm, right? It is the new thing. Everyone is interested in a new thing. So when is it okay? When the child is able to otherwise engage in their life, is still enjoying going out with friends, enjoying offline activities, is able to do the things that they are required to do, maybe by school, maybe by, home, or the chores, the parents' requests at home. As long as all of that is there and the child is still using the internet, and there might be some reluctance, but when the child is able to give it up, when asked to sort of switch it off, or that is okay. When it becomes a problem is when the child is foregoing everything else, is foregoing his or her peer group outside, playing outside, the usual interests, the passions, the hobbies, not spending any time in what needs to be done, maybe school preparation or helping out with chores at home. And there is excessive, say, irritability or panic or anger or some kind of oppositional behavior when the screen is, told to be switched off. When there is a secrecy in using it, that is, the child may be using it behind the parents' back or without their knowledge, and there is a need to be on it all the time. And if there is a mood shift when the child is not online, that is, they appear to be more dysphoric, listless, sad, maybe that should ring some bells, that the child is probably going in for something and that needs to be evaluated by a professional. So these could be red flags that the parents watch out for. And when they come to us, we will sort of evaluate the situation as a whole. Now, why is it that the child is seeking out visual stimulation in the form of screens? We have to rule out neurodivergence, right? Because if it was to be ADHD, the difficulty in perseverance, the low attention span is going to make the child want to seek out visual stimulation all the time. So is the case with autism, right? When children on the spectrum, that is a kind of sensory seeking, the visual stimulation from the screens that they may be doing. Or whether it is a tendency to avoid other maybe social groups, or is it an underlying social anxiety or depression, which is what is making the child to avoid every other facet of his or her life.
And creating a pseudo environment.
Yes.
Yeah.
Yes. So these are some of the things that the parents can look out for. And if they feel that any of these is what the child is going through, they can always come in for an evaluation.
Could you explain the difference in the roles between various professionals, like a child psychologist, a child psychiatrist? I think there's an educational psychologist, and when it might be important or appropriate to consult any of these?
Okay. A psychiatrist or a child psychiatrist is usually a person who has done their medical degree, done a post-graduation in psychiatry. They will usually assess the child, diagnose the child, and they would be able to help in giving medications as appropriate or as needed for the child. A child psychologist is a person who has pursued the psychology degree, and they will be also able to do assessments for the child. When I say assessments, we are talking about tools to diagnose, to screen any of the psychiatric disorders that we speak about usually, right? So they will be able to do assessments for the child. They will be able to conduct therapy for the child, for the family, for the parents as required. An educational psychologist, or there are many people who are special educators, remedial educators, who will sort of come into the picture when academic related concerns are there for the child, right? So if we are going to take learning disorders, for example, it is not that the child has any deficit. It is that the neurobiological underpinnings makes a child learn the same concepts differently, right? So a remedial teacher or a special educator will be able to understand the strengths of the child and teach the same material in a way that the child finds easy. There are different kinds of learning, right? There is visual, there is auditory, there is kinesthetic. There is just so much of learning nowadays, different types of learning. The previous years of book and pen and paper and rote memory is almost obsolete right now.
Thank goodness.
So, that's true. So that is where the special educator or the remedial educator would play a role in helping with the, say, academic related concerns of the child. There are also a couple more professionals of which the child psychiatry team, they form a part, right? There is an occupational therapist who will be helping when the child comes in with, neurodivergence related concerns. It could be attention enhancement activities. It could be related to their motor control. It could be related to the sensory integration aspects. So that is where the occupational therapist will play a role. I'm only saying a couple that they do. They do quite a a bunch of other stuff. And the speech therapist also will sort of come into the picture when there is any kind of speech delay, when there might be, low speech clarity, or they might be stuttering. So those kind of concerns, which are commonly seen in the pediatric department, so-called, we all form the entire team. So the child psychiatry team is not a single person. We have multiple people. It takes a village.
I
Even
was just going to say that.
in the hospital as well, to help a child and a family.
Dr. Gayathri, for any parent or teacher listening, what is the single most important message you would like to leave them with regarding a child's behavior?
Okay. The first thing I would like to tell all parents, adults, is to try to create the atmosphere that we were talking about at home. That is the first step for everything, right? You will be the first adult that they should trust and they should come to, right? And to create such an atmosphere at home where the child feels safe, that there is no judgment, and that anything can be told at home, and that it would be taken care of, or the child would be helped in the situation. That is the first thing that I want to tell all parents or adults at home, to strive to create that atmosphere for the child. And the second thing, when the child, this generation, right? I love this generation. I'm talking about the youth of this current world. I love them because they are so open, right? They are so self-aware. They know what they need, right? And they do not shy away from...
And that's because of the internet.
Sure, maybe some of the positives of the internet, some of them, right? But even then, I feel the children of today, they do not shy away from difficult conversations. They are aware of what they need. So if the child comes to the adult and says they are feeling a certain way and that they would like some professional help, it would be nice if the adults sort of took it took it up, understood where the child was coming from, and actually, held the child's hand and took them to take the help that the child was seeking. The child also feels reassured in that sense, that it is not something that I need to go through by myself. I have support even in this process. So maybe these are the two things that I would probably request from all the adults of today.
Well, we're going to say goodbye for now, and I do want to mention a special episode that we're going to do with you and one of your colleagues. I'm very much looking forward to that, discussing autism, late diagnosed autism, differences in various neurodivergent spectrum among genders and age, and that's going to be a long-form conversation, and for me, special area of interest. That's going to be a good time. So I can't wait to see you again. Thanks for coming today.
Thank you so much. Thank you so much.
That was a very illuminating episode. I hope you enjoyed our discussion with Dr. Gayathri, and I know I look forward to speaking with her again and expanding on these topics we touched on today. I'm Ellen Chamberlain. This is the Mind Reimagined, where we talk about paths to wellness. See you next time. You've been listening to The Mind Reimagined, Paths to Wellness. Continue to tune in and heal within. See you on the path.